Hello, everybody, and good evening. It's me, Dr. Charlotte Norton, again, here for another Facebook Live with you this evening. Thank you for joining me. So, as I said, I'm a doctor by my nature, and I'm the medical director of the Slimming Clinic. So, working in weight loss is my bread and butter. It's what I do every day, and I'm very proud to be part of the Slimming Clinic. So, I'm going to be with you this evening, talking all things weight loss medication. I've got some questions that some of you've sent in beforehand. That's absolutely fantastic, and I'll crack through those. But also, if there's any questions you want to ask, whether you're a current patient, taking medication from us or elsewhere, or you're thinking about taking medication, you've got any questions, whether you think they're silly or you'd be afraid to ask them, please do go ahead. I'm happy to answer anything, and if I'll be sure I've heard it already anyway. So yeah, please do. It works so much. It's so much nicer when I get a bit of engagement from you with some questions that you might have that I can answer instead of me just waffling on at you. So thank you. I can see some of you are joining me now, and thank you for joining me on a sunny evening. I know everyone would probably like to be sort of more out and about than watching on a Facebook Live, but I think that's something that makes us think sometimes about our weight as the temperatures warm up and as we pull out our summer clothes. Sometimes they can be a bit tighter than they were last year, or we can feel like, actually, oh gosh, I don't know if I'm comfortable getting back in to that pair of shorts. And it can be a time when we think, actually, do you know what, maybe we do need to think about weight loss. And that can be a time to think about using a tool like weight loss medication, because that's what it is. It's a tool. It's not a super fast fix. It's sadly, you don't inject it and all your fat melts away. I wish it did, but it doesn't. You still have to make those diet and lifestyle changes alongside the medication, but they're a fantastic tool. We see brilliant weight loss results in patients that use medication to help them with their weight. Good evening. I see somebody's wished me a good evening. I know you've joined me on these Facebook Lives before. So we've got a question there. Can you have the jabs if your gallbladder's removed? Yes, you can. So when you are taking the medication, if you've had a history of a gallbladder inflammation or gallstones, we tend to treat you with caution. So you can, even if you've still got your gallbladder, you can still have the medication, but we follow you up closely to make sure that you don't get any signs of recurrence. And generally that can happen if you're losing weight a little bit too fast, which I know feels like a good thing, but can trigger sometimes a little bit of inflammation of the gallbladder. But if you've had your gallbladder removed, you can be treated with the weight loss injections. Yes, absolutely. And this is, I think, questions like this and medical questions are a really good reason to engage with a service like the Slimming Clinic if you're looking for weight loss medication, because obviously we've got doctors. So our service is completely doctor led. So whether you attend an appointment with us or whether you use our online request service for medication, it's always a doctor that looks at the information you provide. They look at your medical history, they look at any history if you've been to us before as well, to really build that picture up of you and make sure that not only the medication that you might have picked for yourself or you might have thought would be suitable for yourself is safe, but also it may be another one might suit you better. So we can always help and advise on those. So, Mike, you've had a consultation with one of our doctors on Monday, was wanting to transfer to order online. So obviously, if you come through to our consultation service and you have your appointment with a doctor, at the end of your consultation, you get handed over to a member of our support team who, if you're going to go ahead and purchase medication, can take the payment there. If you wanted to utilize the online service and the online prices, then you need to navigate to our website and go through there. Our team can't put you through the online service because that is sort of a self-service, if that's what you mean. But Ma, thank you for adding that. And what we'll do is we'll just direct that back to a member of the team and get somebody to help you with it, because if somebody said they were going to get back to you, then we can absolutely have a little look and see what's there, because we do have those two differentiations. So if you are taking are having treatment with us through the appointment way, obviously you're getting appointments with the doctor, you're getting their time and expertise, so the prices differ from those that are on the website where you simply get the medication. Although we give you some supportive information, you don't get that one-on-one time with the doctor to sort of dive into your sort of diet and lifestyle and get those tips alongside the medication that can help. So we sort of have a difference between the two, and therefore there's a different price point between the two. Mark, so another question. And when do you know when to go up or down a dose? That's a really good question, and we get asked this a lot. So the weight loss injection medication, you increase the dose over time. Now, Wegovy is one of the types of injections and Mounjaro is the other, and each have a different dose. At a minimum, you need to do each dose for 4 weeks, and each pen that you get is a fixed dose and is 4 doses. So, sorry, four, can't count, 4 doses. So it lasts 4 weeks. Okay. So at a minimum, that is, you need to do those four injections at that dose. That gives your body a chance to get used to the medication and a chance for you to see not only your weight loss results, how well you're tolerating it, and if you experience any side effects or unwanted effects. If all is going well after you've done those 4 injections at that dose, you can go up in dose. But it's always what we say is have a think. Do you need to go up in dose? Are you feeling in control of your appetite, which is what the drug does? And are you losing weight? If you are, you could stay at that dose and do another 4 weeks at that same dose. Or if you feel, actually, do you know what? I'm still not quite there. I feel like I'm still getting a bit snacky at times, or I still don't feel like I'm making the best dietary choices, or it could be a time to actually go up in dose. And that's fine, as long as you don't have any niggly side effects. So if you're experiencing a side effect from the dose, like you've maybe got some nausea that's not going away, or it's upset your bowel motions, you're maybe a bit loose or a bit constipated, and those haven't got much better over the 4 weeks, sometimes it can be worth repeating the same dose again before you then go up. So there's those 2 points to look at: how you're tolerating the medication, how your weight loss is going, and how your appetite's controlled. At a minimum, you need to do a month or 4 doses of each dose, and then you can go up. However, it is not a race to get to the top dose, and just getting to the top dose doesn't mean you'll get the best weight loss results there. You start losing weight effectively right from the beginning. The dose that's right for you and the most effective for you is the one that's working. Every patient differs. Some people titrate or move up the doses quickly. So every 4 weeks they move up, and that suits them and their body and their goals. Other people stay on the lower doses for a long time. Some people stay on the bottom dose the entire time. There is no set rule, except for making sure that you do at least 4 injections of each dose before you consider moving up. So I hope that answers your question. But the reason that it's like this is because the way these drugs work, the injections work, is like our weight loss tablets. They have an effect on the appetite control center in your brain, but they also have a direct effect on the gut. And if you go up in dose too soon, either without doing four doses, or you have a side effect and you move up, sometimes that causes gut disruption and can make you feel bloated or nauseous, or have unwanted side effects, which actually, if you just stayed on the same dose for a little bit longer, wouldn't happen as you go up. But also, again, if there is a niggling side effect that isn't settling, then the injection that you might be on might not be the best for you, and actually the other one might suit you better. Although they're the same classes of drugs, they are different drugs. So if one doesn't quite suit you, the other one might. So again, it's worth thinking about that when you're looking at the landscape. But the key is this medication is helping you lose weight and be in control of your appetite. If it's doing those 2 things, then it's working. The dose I am on, have little appetite but not losing weight. Okay, so that's good. That's really good, that in terms of you're in control of your appetite. But then it's a case of looking at why the weight loss isn't happening at the rate you want it to. So we aim for a sustainable amount of weight loss, which is what we say is like 1 to 2 pounds or half to a kilo per week. That's a good place to be. That means you're burning fat stores, you're not losing muscle mass. Maybe you've got past that beginning stage where you start losing weight and you get a huge water purge at the beginning, and you, like, in a week you've shifted 9, 6, 7 pounds, and it feels like crikey. But a lot of that is water weight that slides away as you start to create a calorie deficit in your body. What we want to burn and what we want to get rid of is fat, and fat it is a job for your body to break it down. It doesn't just melt off. It has to chemically be broken down, released, and got rid of. So if you can get 1 to 2 pounds or half to a kilo per week of fat going down, you're in a really good place. People lose weight in different speeds. Some people have a couple of slow weeks and a fast one. Some people do really, really fast and they go really slow. Some people are slow and consistent from the beginning, but they get there. And that's all that matters, as long as the weight is coming off. If it's not coming off, then sometimes it's looking at what, when, and how you're eating. Because that's key, because your body is a machine, and to burn fat and to lose weight, it has to do things. It has to, like I say, break down stores. So it needs fuel to do its best, to have your fire burning, you've got to feed the fire. So sometimes it can be with these medications, people think, I'm not losing enough weight, so I'm going to eat even less, and that slows everything down. So make sure you're not eating too little. What you're eating as well, make sure you're eating the right things. Again, sometimes, and I'm not saying this is you, Ange, for example, but sometimes what we do with these medications is just use them to eat less of what we're eating now, and that might not be the perfect balance. You might not be getting enough of all the food groups, and therefore that might be slowing your eating down as well. Times of day, so there's loads of factors that could sometimes be the case. Sometimes if you're getting towards the end of your journey and you're still doing what you were doing when you started, actually we've got to look at it all again, because your body's changed, your body composition's changed. We might have to look at that diet. If you've always dieted like that and it's got you so far, sometimes you've got to change it up. Sometimes we've got to increase a little bit of activity. Now, I call it activity, not exercise, because you don't all have to start, pounding the pavement and running and doing all manner of things you don't like, just moving a little bit more. So using the angle of getting a bit more calorie burn from movement alongside the calorie deficit you're getting from reduced appetite. So there could be a few reasons that you can look to figure that. But slow and steady, to be honest, I always think slow and steady is really good, because it means your body is doing what it should be doing. And also we see when people lose a lot of weight rapidly, whether it's from things like bariatric surgery, or sometimes in the case of these medications for some people, actually that can have detrimental effects on the body. Some of the cases where people have lost their hair comes from the stress response in the body from dropping weight a little bit too quickly. So slow and steady means you're in that fat burning zone. You're losing the fat because that's what we want to get rid of. We want to keep our bone and muscle mass, because that's what gives us our shape when we've lost and our strength when we lose the fat mass alongside it. And is a great way. The patients, I think, if I reflect whilst I'm saying this back on the patients I know that have had the most success over the years I've been prescribing weight loss medication, which is 10 years, to have a slow and steady approach. Those that go really fast tend to get really despondent when it slows down and give up, and actually slow and steady tends to get you to the right place over time. So I would carry on, but think about changing it up. Look at your diet. We have a membership area which has got loads of great information about what to eat, how to eat, how to get the most out of taking the medication. So you might pick up some tips and tricks in there as well, to help support your weight loss efforts. Or absolutely, you can book an appointment with one of our doctors if you just want to have a bit of a deep dive with somebody, just to have a little look and see what you're doing, and get a bit of support there. Just to say, that membership area that we have is for anybody taking weight loss medication. You don't have to be a patient of the Slimming Clinic. So if you're taking weight loss medication you've got from elsewhere, but you want to look for support and information from a medical provider, then please navigate there. So actually, that question about dose was one of the questions someone has sent in before. What's the starting dose and the highest dose of Mounjaro? So Mounjaro goes up in 2.5 milligram increments. You start at 2.5 milligrams for 4 weeks, and then when ready, you go to 5, 7.5, 10, 12.5, and finally to 15. As I said before, not a race to get to the top, but they're all of the different doses. You must always start at the beginning dose, even if you've been on another form. So if you've been on Wegovy and you switch to Mounjaro, you need to start at the beginning, because even though they're similar, they are not the same, and you don't want to end up with an unwanted side effect that makes you stop the medication, and vice versa. If you've been on Mounjaro, you need to go back to the starting dose of Wegovy. But as I say this all the time, you start losing weight from the first dose. You don't have to get to the top dose to get your weight loss results, and some patients we have managed to achieve their entire weight loss goal without hitting that top dose. So there is no rush. It's you, what suits you, and what gets you losing weight. So another question we get quite a lot is, how long should I stay on weight loss medication, and what do I do when it stops? So I think there's two ways to look at this. What I first of all say to people is, let's just get you there first. Okay, let's get you to that goal weight. Let's get you where you want to be. Along that journey, we're going to learn a few things. We're going to learn about how much your body needs to eat, because your appetite will reduce, and you'll be learning naturally how to have different portions, how to eat a bit less, and seeing how that goes, and your stomach shrinks to that point. So you should be, you'll find that. You'll also look, and the people that get the best results and maintain them are those that make lifestyle changes with it. Now, people say make lifestyle changes and everybody sort of, panics. Gosh, have I got to completely overhaul my life and be completely different? No, you don't. You don't have to do crazy big huge things. You don't have to become a runner if you're not a runner. You don't have to become, somebody who eats just vegetables if you hate vegetables or whatever. You just have to find ways that suit you and your lifestyle, that make changes that are sustainable for you, that work for you, and that you can keep up thereafter. There's a big study that's done. It's an American study where they study people who have lost a significant amount of weight and kept it off, and they survey them every year to see how their weight's gone and to look for things that they do that mean that they keep their weight off. And a couple of things that always ring really true with me is, number one, is they keep weighing themselves. Now, not every day, maybe once a week or once a month, but they don't bury their head in the sand about where their weight's going once they've got to their target. They keep cognizant of it. They stand on those scales, or they measure their waist circumference, or whatever they want to do to check in with themselves, to catch themselves if they start to go the wrong way. They've all added a variety of movement in, which again they've kept up for at least 4 days of their week. So whatever that was, whether it's swimming, cycling, running, walking, whatever that physical activity is, they've done that, and they've kept that up as well. So just some very simple things that you can do at the end. Now, at the moment, the medication itself is licensed for weight loss and maintenance. So you can continue on the medication for a while when you are maintaining the weight that you've got to. Everybody's really different. Some people like to reduce the dose during that time and come to the lower doses so they kind of see how they're doing with dropping the medication. And again, then it comes down to personal choice and also financial viability. You've got to keep paying for this medication. So how long do you want to continue it for? For our perspective as medical providers, we will work with you to continue prescribing to you with your maintaining, as long as your weight doesn't start to go too low, or we start to have concerns that you're not having a healthy body composition. But otherwise, you can continue on the medication into maintenance. But as I say, right at the beginning of your journey, don't worry too much about what you're going to do at the end. Use this as a really good tool to get your weight where you want it to be. And then when we get there, we can absolutely work with you to support you to maintain it. And the other thing is, if you stay mindful of where your weight is, if it starts to creep back up again, take action. If you find that you're starting to think, oh, I can't fit into my size 14 jeans anymore, I'm going to have to go up to my 16s. Think, actually, hang on, right, no, come on, let's do a short burst of something and get back and just keep bringing it back, because there'll always be times when weight goes up and down. There are holidays, high times, reasons why you might go through something in your life that you might find stressful or emotional, because we eat for all those reasons, and your weight might go up, but don't let it go all the way back to where you started from. And for us, where we have patients that have had this medication before, if they find that their weight's going back up, it doesn't have to go back up to a BMI over 30 for us to consider prescribing to you again, because obviously we're not going to take the position that you've got to go back to being obese before you can have the benefit of taking medication. We will absolutely review you, and if we're seeing that you're starting to go back into a negative place, if you're starting to gain weight and feeling a little bit out of control with your eating and things, we can prescribe to you. So we've got the ability to if you've been a patient of ours, to look at you in that way. And that's the value of having doctors and people that can actually look at your care as a holistic picture. So you've asked a question about, why do I have to take 2 weeks break after my 12 weeks? So this is a question about our weight loss tablets. So we prescribe two main groups of medication at the Slimming Clinic. We've got the weight loss injections, Wegovy and Mounjaro, and we have the weight loss tablets. The weight loss tablets are a daily tablet you take every day, and they work on the appetite control center of the brain, like the injections do, again to reduce appetite. This class of drug is licensed or used for what we call short-term treatment. So this can't be prescribed for ongoing. We can use it for short-term treatment to achieve weight loss. And what we look for is to make sure that you are continuing to have a steady stream of weight loss. So when people get to about 12 weeks, 3 months, we look and see how your weight loss is doing. If your weight loss is continuing well, then there's no reason to take a break from the medication, and you can continue on we usually do like another 4 weeks and then review, and then so on and so forth. If at about 12 weeks, sometimes patients that take the weight loss tablets notice that actually maybe things are slowing down, or the appetite reduction isn't quite as good as it was when they first started, then we suggest that you take a break, which is usually 2 weeks, which is the time it takes for the drug to be completely out of your system, and then restart it. And we find doing it in that sort of pattern over the years that we've been prescribing this medication actually yields the best weight loss results for patients. It is not an absolute rule you have to take a break at 12 weeks. Again, it's reviewed by your progress and how you're doing and how in control of your appetite you are. But you will find, if you're on our weight loss tablets, there will come to a point that you may have to take a break for a week or two. But as we say, that's how the reason we do it is because we know patients get the best weight loss results by doing it in that way. And because the medication takes that time to come out of your system, it's not like in those 2 weeks all of a sudden your appetite comes back with a rage and you find your weight goes up. Often you find actually you do just fine in those 2 weeks, and then you start the medication again and have another wave of successful weight loss. So one of the other questions I had before, how long do Mounjaro side effects last? So we've touched on this. So the side effects of Mounjaro tend to be gut related. The vast majority of them do. So again, that can be feeling a bit bloated at first. It can be being a bit more gassy. So maybe belching a little bit more, maybe a bit of indigestion, maybe sometimes people can get a little bit constipated. Sometimes people can get a little bit loose with their stools. Now, some people get some side effects, others don't. With all medications, some people tolerate it really well, and there's others that it isn't suitable for. So again, once you start the medication, you should always, as with any, just see how you feel, and if you're a patient of ours, let us know if you're experiencing something you're not sure of. Usually, again, with new medication, it's usually transient, and it's usually in the first week or so that you experience these. We tend to find with the injections that it's within 48 hours of taking the injection that patients notice any side effects that they may or may not experience, and they usually last for a day or so. That tends to happen each time you go up in dose, or you might find that if you're somebody that maybe it gives you a bit of indigestion, each time you take the same dose over that period of 4 weeks, you might find that actually you don't get as much indigestion, and then actually it's gone. And then when you go up in dose, it came back a little bit, but then over those 4 weeks it goes. So there could be, it might peak a little bit at times, but as long as it's not a side effect that's causing you disruption in your ability to function each day, it's not significant to the point that you can't tolerate it, then you may find you just get it each time you go up in dose for a little bit. But that is just to do with the mechanism of action of the drug. And again, a real reason to be mindful of when you go up in dose, to make sure you're doing it at the right time, so that you're not perpetuating any side effects that you may or may not be experiencing. You've asked again, can you increase the milligram tablets? So with the weight loss tablets, they come in 2 set doses. So if you're on a medication called Fentanyl, there's a lower dose of 18.6 milligrams and then a higher dose of 37.2 milligrams. They're the only doses that are available. And actually, in clinical studies, which were done a few years ago, because these medications have actually been around since the 1950s, they found that actually doses above that didn't give any more superior appetite suppression, but actually only gave side effects. So that's why those 2 doses were those that have been picked, because they're the most efficacious and the best tolerated. And generally weight loss tablets are tolerated very well. So no, actually the milligrams don't go up any higher than the 37.2. And yes, we know that's the most effective dose for appetite suppression of those medications. Somebody asked which weight loss medication works the fastest. So between tablets and injections, people say when they take the tablets, they tend to notice on the first day they've taken the tablet that they feel their appetite reduced. And that's because the tablets, obviously, you take them, they go into your stomach and they are broken down that day and quickly go into your bloodstream and give you the effect. With the injections, people tend to say it takes that 48 hours before the appetite suppression kicks in. But that's only relevant when you start, because then you're always going to be taking another medication thereafter. So we're talking 24 to 48 hours difference between tablets and injections. So it really it isn't significant. So again, the medication that's the best for you and the fastest for you is the one that works the best for you. And the final question that I got sent in before, which I will answer, is weight loss medication suitable for pre-diabetes? Now, this is really interesting, because obviously these weight loss medications, Wegovy and Mounjaro, came about because actually the medication the GLP-1 medications were initially brought to market to treat diabetes, type 2 diabetes, so not type 1 diabetes that you're born with due to genetic reasons, but type 2 diabetes, adult onset diabetes, the one that tends to develop due to lifestyle reasons. And this medication helps to balance blood sugar or help with blood sugar control. And it was the use of these medications in diabetes that it was noted that patients were also losing weight, and that's how they came about. So yes, these weight loss medication is suitable in pre-diabetes. The only time it might not be is if you are on treatment for diabetes with a medication that reduces your blood sugar. So realistically, we're looking at things like insulin, which is in type 1s and some type 2s, or some other types of drugs that you can get with type 2 diabetes. That's not pre-diabetes, but when you actually have frank type 2 diabetes, and usually you've been prescribed a medication because diet and lifestyle changes haven't managed to reverse the diabetes, then you should be fine to take these weight loss medications. And you may then get the double bubble, which is that they also help with the diabetes as well as helping you lose weight, because we know that actually for pre-diabetes, diet and lifestyle changes resulting in weight loss can actually help and reduce the risk anyway. So the answer is obviously yes, because generally in pre-diabetes you haven't yet been prescribed any medication that would be a reason not to. Thank you for your questions. I think one last thing that I wanted to touch on was something that was brought to our attention this week, and I thought it would just be really interesting for those of you who maybe aren't on weight loss medication or maybe looking for it. Is it was made aware that there was a fake website set up online which was selling weight loss medication, or appeared to be selling weight loss medication, which sadly people have purchased on, but actually this pharmacy doesn't actually exist. So it was a scam. Patients' money was being taken and no medication was being given. So one of the things I think is always really important, and I've touched on this previously, and obviously, we have these semi-clinics. If you are looking to buy medication online, you need to be making sure that the provider you are choosing is credible, is registered, and actually exists. There are things to check. So obviously for a service like ours, which is a clinical medical service, we're not an online pharmacy, we're a medical clinic. We have registration with the CQC. So you can look up our registration number on the CQC website, see that we exist. You can see, our names are on there. There is also you've got with regards to the pharmacy that's dispensing the medication. So for us at Syndicate, we have our own pharmacy. So you can see our pharmacy registration. You can see on our website our registration number, and you can go to the General Pharmaceutical Council website and check that that's real and see that it's registered to us and that there's a real life human being pharmacist that runs that. So if you've got those registrations, then you should find that you've got a company that is legitimate and is registered by the UK governing bodies that keep an eye on making sure that these services are correct, and the prescriber credentials. So again, you want to make sure the prescriber who is prescribing, or the team of prescribers that work for the company, are legitimate as well. So for doctors, you're going to be looking on the General Medical Council, the GMC, and for nurses and midwives, you want to be looking on the Nursing and Midwifery Council. Sometimes you've got prescribing pharmacists, again, on the General Pharmaceutical Council. So these are the sort of things you want to look at, and don't just read them on the website, check them out yourselves. You can check, you should be able to click on them and they should take you through to the relevant pages. But again, be mindful and look these things up yourself, because there is a lot of places that claim to sell weight loss medication because they know lots of people are looking for them, and everybody knows that these weight loss medications are expensive. So people, everyone's naturally looking for the most cost-effective way to access the medication. So just make sure that you know where you're getting it from and that the service that you're getting it from is legitimate. Obviously, at the Slimming Clinic, we have all those credentials. You can see them on our website, not just take my word for it. But do be careful if you're looking for or sourcing weight loss medication, because you're making that big leap to invest in yourself, not only because you're going to buy some weight loss medication, so financially, but also you've made that leap that you're going to, right, I'm going to do this, I'm going to lose weight, and I'm going to use medication to do so. So you want to make sure you get off to the very best start. So at the moment, obviously, as I mentioned, we have both our appointment basis. So if you want to come through and speak to one of our doctors about weight loss medication, different appointment types to suit you. We've got longer appointments where you can have more time with the doctor to talk about diet and lifestyle. We've got slightly shorter ones if you're a busy person that just needs to sort of slip an appointment in across a busy day. And then we have our online prescription service as well. So we hopefully have a multitude of ways that you can interact with us to source weight loss medication. At the moment and across the bank holiday, we've got free postage and packaging on any medication that you're deemed suitable for. So if you're using our online prescription service, there's free postage and packaging available at the point that you check out. If you haven't bought online or requested online medication with us before, you will have to complete a medical questionnaire after your purchase, just so that the doctors can review your information and make sure you're safe and appropriate for the medication you're requesting. So thank you everybody for joining me this evening, and thank you for your questions. If anybody wants to ask a question that they haven't asked here, or you're watching this on record, then please do put it in the comments and a member of the team will get back to you, or I'll try and answer myself. But if not, thank you very much for joining me this evening. It's been great, and I hope you've all found it informative, and I hope everyone can enjoy the rest of the sunny weather. Thanks everybody. Bye bye.